and the cost of housing. The result, families with young children, and hang on one second, I'm just going to unfreeze my screen here. There we go. Thank you. Families with young children are squeezed for time at home, and they're squeezed for money. They're squeezed for money. They're squeezed for money because of the higher student debts, higher housing costs, and stagnant incomes. They're also squeezed to find and afford the quality childcare services that they need to maintain their incomes. That's why the Gen Squeeze campaign is now building a movement that speaks up for younger Canada. Check it out at gensqueeze.ca. But our analysis of this time, income, and service squeeze, or time, money, and service squeeze, and the required policy solutions is grounded in a large body of evidence about families with young children today. In this presentation, I'll touch on some of that evidence using a range of comparative analyses to tell my story. And when I think of stories, I think of Thomas King, an award-winning novelist and short story writer of Cherokee and Greek descent. I have learned so much from and been inspired by his writing, both about Native history and about our society in general. I think some of his very memorable quotes have broad application, and so it is with respect that I frame my presentation around them, beginning with what I think is the most profound and concise quote. Canada is, according to Canada, a just society. I chose this quote from his book, The Inconvenient Indian, because in this one short quote, it captures actually the essence of my presentation, which focuses or rides around two key points. First of all, that the dominant story is that Canada is doing well, or better, at least better than most, or at least as much as we can. And when one story dominates, it's hard for another to be heard. The other reason that I chose this is because in a rather cheeky way, it reminds us that we tell that story without critical analysis. In other words, it's true because we say so, not because we necessarily offer evidence to support this story. So when evidence is shared that contradicts a dominant story, we question it. In 2008, UNICEF published the most comprehensive analysis I've seen about how 25 developed countries are supporting families with young children. UNICEF started with the UN Convention on the Rights of the Child, and specifically the rights in early childhood, as are outlined in General Comment 7. Most countries, including Canada, have signed on to, and they've agreed to be monitored on their progress towards fulfilling these rights. So it makes sense to use it as a framework for the assessment. The authors added an extensive review of early years research and established a set of minimum standards or benchmarks for protecting the rights of children in their most vulnerable and formative years. 10 such benchmarks were developed, and they are applied to 25 developed countries. In this table, I've extracted some of those countries, listing them starting with those who met the most benchmarks. So Sweden, for example, met all 10 benchmarks. Canada, on the other hand, ranked last. This is not a story that many of us understand or intuitively believe, because it's at odds with the dominant story about Canada. Although the report was released in 2008, it raises questions to this day whenever I share it. And in fact, as you can see on the right-hand side of the screen, in 2011, we did a national poll asking Canadians if they believed that Canada ranks poorly, or knew, or they believed that Canada ranks poorly for investing in families with young kids. And over 55%, the majority of Canadians, didn't know or didn't believe that. So I've structured this presentation around some of the questions that I'm regularly asked about family policy and about how we support families with young children. I'll explore the UNICEF, I'm going to answer those questions and I'll share them with you in just a moment. And I'll explore the UNICEF report in more detail and bring in additional and updated analyses. I'll also show you in this presentation how implementation of our proposed solution, the New Deal for Families, that's part of our Generation Squeeze campaign, would impact and in fact bump up our low family policy ranking. So here are some of the frequent questions that are asked. First of all, are we really comparable? Can we really compare Canada to other countries? And of course, behind that is a sense that we're very different. And why? would Canada be so far behind other countries, other developed countries, with who in other ways we might consider more similar? And then there's a question that is frequently asked, at least in BC and potentially in other provinces as well, and that is, how can we be this far behind when in fact we have spent more on the early years in recent years, right? Fourthly, a common question is why, and when we're doing these analyses, is there such a significant emphasis on childcare? And finally, when we talk about the solution and the kind of collaboration that's required between senior levels of government and municipalities and so on to bring about significant change, the natural question that arises, is cooperation between levels of government really possible to affect this change? So let's start with the first question, are we really comparable? And again, what's behind this is a sense that our cultures and economies are so different around the world. And I really want to start with a short story to question that assumption of difference. In 2012, I had an opportunity to go to Geneva for reasons I'll describe a little bit later. Clearly, you can see from this slide that I was not there at the height of the tourist season. But a colleague who lived on the French side of the border invited us to visit the child care program at her daughter's school. And I enjoyed a lovely tour, seeing large, spacious, bright rooms with lots of windows, young children ages 3 and 4 around playing and enjoying themselves in various activities. And at the end of the tour, I asked the director of the child care program, through a translator, how much parents were paying in fees for this program. And she looked back at the translator with a real puzzled look on her face. She thought perhaps she'd heard the question wrong or had been translated incorrectly. And I repeated it, and the translator repeated it, and then she said, no, there's no fees. This is school. This is school. So despite significant cultural and other differences between us and France, there are similar expectations embedded in the word school. We both expect good quality. We both expect school to be free. We expect it to be universally available. And we may differ around a few things, the teacher training, the age at which school starts, but we have some very comparable and generally understood understandings about what school means. So when recently the BC government announced they were expanding kindergarten to a full school day, there was no controversy about how much families would pay in fees, whether there would be trained teachers in the program, etc. But now change the word school to childcare, and a different set of cultural values here in Canada, in parts of much of Canada, outside of Quebec at least, a different set of cultural values often comes to the forefront, even though both programs share similar characteristics. Both school and child care are teacher-led programs that focus on children's development in partnership with parents, but generally without parents' regular participation in the program. In this presentation, you'll see that I use words like child care, early childhood education, ECEC, early care and learning, and kindergarten interchangeably for that very reason, because they share similar characteristics at their core. But of all these different words and programs, it's public education or school that is a large enough and well enough established system with an infrastructure in place and a longevity to it, which means that I think we can, and in fact we do, I know we do, compare ourselves to other countries on a regular basis. Look, for example, at the reports that have come out from the OECD, the Organization for Economic Cooperation and Development. They actually maintain a family database that tracks over 60 indicators of family life in developed countries. And here's one example, PISA, the International Reading Assessments that are done in this particular case at age 15. So a couple of points to make about this slide that will actually be relevant as we move to other slides as well. Throughout most of the presentation, I will generally compare Canada to 5 other countries, 2 Nordic countries and 3 others that are generally thought of as Canada's peer nations. So I'll compare us to Finland and Norway, chosen as the 2 Nordic countries, even though I'm sometimes told that I should not compare to the Nordic countries because they're so different. And I'll also compare to Australia, the US, and the UK, countries that are considered Canada's peer nations because of some similarities around our structure and our histories and so on. In this case, we also have the OECD average. But look what happens here. What I observe is that when we have results like this, where Canada ranks very, very well, not only in comparison to its peer nations, but also in comparison to the Nordic countries, we don't have any problem with a comparison. In fact, we don't say you can't compare us because we're so different when we like the outcome. I observe that we tend to say that when we don't like the outcome. Now, this is an example of a comparative analysis with just one measure, whereas the trend is towards multiple, excuse me one sec, I'll get that off your screen, whereas the trend is towards multiple indicators used in combination to tell a more comprehensive story and often to rank jurisdictions accordingly. The UNICEF report is one of the few examples of this approach, multiple indicators, in regards to the early years that I'm aware of, and it's an ambitious undertaking. Let's look at some other examples of multi-indicator rankings and see how Canada stacks up. I'm going to put up now a rather detailed screen with 4 international comparisons on it, and let me just bring them up and explain them briefly, and then we'll take a little bit of time to actually analyze them. So I'm going to start here with an economic ranking. This is the World Economic Forum, which annually and for several years has put out a ranking now of 148 countries looking at their economic competitiveness. And it looks at over 100 indicators of productivity and prosperity, everything from GDP, several GDP analyses, to the number of mobile telephone subscriptions, looking at health, education, etc. And here are the rankings for the 2 Nordic countries in the group that I've chosen. So Finland is ranked number 3 in terms of economic competitiveness, Norway number 11. And Canada's peer nations, United States, UK, Canada, and Australia round out basically the top 20, close to the top 20 with Australia in 21, of the most competitive countries in the world. The next ranking I want to share with you is one it's a more recent ranking put out by the Global Age Watch. It's the Global Age Watch Index. And this particular ranking has 13 indicators for 4 key domains of healthy aging. They look at things like income security, health, education and employment, and what they describe as an enabling environment. So looking at things like access to transportation. Out of 90 countries, you can see Finland and Norway are in 15 and 2. United States and down to Australia fill out again the top 20. So all 6 countries are within the top 20 internationally in terms of healthy aging. The next measure or metric is around gender equality. And for this, I'm using the ranking that is again produced by the World Economic Forum. Several years ago, they determined that key to economic competitiveness is actually closing the gaps around gender equality. And so it's key to improving the world in general and to improving economic competitiveness. So they developed a framework for benchmarking how countries divide resources between men and women, irrespective of how wealthy the country is, whatever level of resources they have. So again, you can see how Finland and Norway rank, and then our 4 countries to compare to. And finally, I'm putting up the UNICEF Finally, I'm putting up the Family Policy report developed by UNICEF that I referred to earlier, looking at 25 of the developed countries in the world and assessing them against 10 benchmarks. In this case, what I've done is convert the number of points or benchmarks that each country received into a ranking. And because some were tied, then the ranking winds up being tied. So those are 4, I think, important and interesting comparisons to take a minute to look at. And what I want to suggest to you is that this tells us maybe we can pick up at least 4 stories emerging from this comparison. First of all, When we consider economic competitiveness and healthy aging, Canada and its peer nations compare well with the Nordic countries. Sometimes Canada is in the top 10, sometimes the Nordic countries are in the top 10, but they are all within the top 20, and there's some mixing and matching between the two of them. Where we diverge is when it comes to gender equality and family policy, with one minor exception around the UK, where it's introduced some family policy that actually has not, does not promote gender equality. And we can talk about that later if people have more questions about that. So the minor exception, but generally we diverge from the Nordic countries when it comes to gender equality and family policy, where they stay at the top ranked, and we move down substantially. So generally we find that gender equality and family policy are correlated. We're unlikely to do well at one without the other. And finally, I just want to point out, for those who sometimes worry that, or when we hear questions about how can we invest in family policy when we have to actually maintain a strong and robust economy, let's look to Norway as an example of a country that has managed to have a healthy economy, support healthy aging, support gender equality, and support families when their children are young. So we can have it all, as Norway highlights here. Let's move on to the next question. Why are we so far behind? Well, I want to really clarify at first that it's not because we can't afford it. It's not because we can't afford to prioritize the public cost of the family policy solutions that we propose in the New Deal for Families. It's really a question of choices. Two examples to explain that. In recent years, the federal government has reduced GST by 2 percentage points, and the cost of taking away those tax dollars would cover more than half the cost of the New Deal for Families. And furthermore, between 2007 and 2010, we chose here in Canada to increase healthcare spending by an amount that would pay for the entire New Deal for Families. I think one of the key reasons why we lag so far behind is because we do not yet have a shared understanding of the depth of the time, resource, and service squeeze, or the time, income, and service squeeze on families with young children today, and about the scale of investment required to reduce the squeeze. Here's an example of this perspective. This slide reflects a picture of a model I've developed with colleagues to describe public services such as health and libraries and education. Whatever the service, there are two key attributes that we seek to maximize. Quality, and that's measured by the investment in the service up the vertical side of the chart, and access, which is measured by the horizontal side of the chart, and that's the percentage of the population that has access to the program. So in a perfect world, of course, we'd be looking at a combination of user fees and public funding that meshes to create a high-quality service that is universally available, that is accessible and affordable for everyone, and that includes our most vulnerable. In other words, robust universal systems reflect the proportionate universality that many of us heard Clyde Hertzman so eloquently describe. And while our health and education systems in Canada are widely respected, of course, and we've shown one example of that with education already, they are not perfect. In fact, many of you would likely describe them as under pressure, particularly for the most marginalized among us, who are the least able to access high-quality services. Understandably, your attention is directed to reaching out to those communities, to filling the white spaces in this chart. That's the place where we're not able to reach enough people, or some people, and where we can't provide them the level of quality that we would like to. And increasingly, we recognize that our ability to reach out and meet these needs is affected by factors beyond the direct scope of the service itself, factors such as poverty and other social determinants of health. While this concern is completely understandable, let's not forget about the power of the universal system. The introduction of health care and old age pensions a generation ago, along with a growing economy, were central to our ability to reduce poverty among seniors from almost 30% to 5% today. Still not where we would want it, where it should be. But in the meantime, as you can see, children's poverty rates have remained stubbornly high, and vulnerability rates of 5-year-olds across the country, as assessed by the EDI, are around the same level, at least in BC here, as seniors' poverty levels a generation ago. So increasingly, in fact, we understand that our ability to provide effective health care and education services is directly linked to our ability to support healthy child development in the early years and other social determinants of health. So what do those early years systems look like? Well, child care or early care and learning is key to the time, income, and service squeeze. So just get that out there. The time, income, and service squeeze on families with young children today. Across Canada, outside of Quebec, we know that about 3/4 of moms with young children are participating in the paid labor force, yet only about 20% of kids have access to a regulated child care space, and that's represented by the small orange column on the left-hand side. Now, that 20% varies slightly depending on the age of the child. It's actually less if for infants and toddlers, and a bit higher for children aged 3 to 5. Nonetheless, on average, it's about 20%. At this chart, I want to take a moment to explain to you what these gaps really mean. So about 20% of children have access to a space. So the difference between that 20% where the orange column ends and the 100% of children that would be in a theoretically universal system have access, the difference between those two is called the expansion gap. That's the gap that we would need to fill to build a perfectly universal system. And of the spaces that do exist, the 20% of spaces that do exist, parent fees are very high. As many of you will know, they're higher than first-year university, and they're much higher than what's considered affordable internationally, which is somewhere around closer to 20% of the total costs. So the difference between the goal of around 20% of total costs and where fees are at right now, the fees that parents are paying, is called the affordability gap. But even when we take the high parent fees and add the small amount of public funding that does exist, it's not enough to recruit and retain well-qualified staff. And so we have a quality gap because of our inability to recruit and retain those staff. And so childcare in most of BC, particularly outside of Quebec, looks much different than the universal systems we just looked at, which were admittedly under pressure. But this is actually not yet a system. And the obvious question that comes to mind is, if 3/4 of moms are working but only 20% of kids have access to a space, where are the rest of the children? Where are the children that are represented by the large white gaps here? And to a large extent, to some extent, if they are in parental care, and that's something that we want to protect and promote, and I'll come back to that as well. But too many of them are in unregulated care, and I wanted to discuss that in more detail. Now, behind this picture are a series of Excel spreadsheets that have been used in work with national and provincial and local groups to work out how to build a child care system. And as you can see already, the model incorporates key indicators for quality and affordability and access, as well as timelines and targets for system building. So the plans are there, they've been costed, and we've done a benefit cost analysis for them as well. But in order to start building a system, we need public and political will on side. A shared understanding that the problem is particularly acute for our most vulnerable and marginalized, and that it applies across the population at large. This is difficult in Canada today because we have two different stories at play. Recently, the Canadian Pediatric Society produced a report in which they observed that the vast majority of families find child care expensive and hard to access. This observation, this conclusion, their analysis is consistent with the picture of child care that I just showed you, with research evidence and with the lived experience that many described to us. and it's consistent with the conclusions of a broad range of other civil society groups. But governments tell a different story, one that does not incorporate key public reporting requirements, like having a plan, having comparative data, and so on. The story that is told at the federal level and publicly reported is that parents are choosing the child care option that best suits their family's needs. It's these two different stories that took me to Geneva in 2012 to share with the UN Committee on the Rights of the Child my observations about them. And my conclusion that why do we have these two stories? Why are governments generally reluctant to share the difficult aspects of our early years support? It's because, I think, because we don't have a public dialogue and a political environment that supports us to acknowledge shared problems and develop shared solutions. And that's one of the things that the Generation Squeeze and HELP in general is working hard to help change. Now, moving on from there, it's time to actually talk about the fact that public spending on early years is up. And it's absolutely true, it is. It's important to acknowledge that, and it's important to put it in context. So let's start with the acknowledgement. In this slide, we compare early childhood spending on over time on programs other than, so not including child care and kindergarten. Clearly it is increased both at the provincial level in the light orange and with federal transfers in the darker color. And this is even after adjusting for inflation, which is what I have done here. We know these results because while I expressed concern before about government's public reporting, the BC government consistently publishes annual reports on early years activity and spending, reports which are generally more accessible than I've seen elsewhere. So from this slide, you can see that about 2/3 of the increase comes from federal transfers and about 1/3 from the province of BC. This increased funding has provided increases to or helped to start up important ECD programs in areas such as Aboriginal ECD, parenting support, midwifery, adoption support, early intervention, and among many others. And despite this spending and the hard work that is happening in communities, we know that overall, as I mentioned earlier, vulnerability rates have in fact increased over the same time period. How do we explain these disheartening results? By putting this public investment in context. One way to do this is to compare it to related expenditures and benchmarks from other countries and jurisdictions. But I'm not aware of international comparisons or benchmarks for the broad range of programs covered under ECD in BC. It doesn't exist, for example, in the OECD family database. My sense is that most of these programs are part of health or education or social services in most countries and not separately identified. So here's a different comparison, but I think it'll still provide the context that we need. We observe here that public spending has increased by $91 million over a decade on ECD programs for the entire population under 6 in BC, which is less than the increased spending announced to move from part day to full school day kindergarten just for 5-year-olds. And even the increase in kindergarten spending can also be put in context, which I'm going to do on this next slide. Here we look at another single measure, a single indicator, public investment in early care and education, expressed as a % of GDP. This OECD, Organization for Economic Cooperation and Development report, showed that Canada ranked last out of 14 countries in total in terms of its public investment in early care and education. Canada's investment was actually shown at about 0.25% of GDP. But here at HELP, we did our own estimates of the public spending, updating and making them as generous as possible, for example, by ensuring that they included kindergarten. We estimate that Canada now invests about 0.34% of GDP. But that figure is heavily influenced by Quebec, as I'll highlight in a minute. So BC and most other provinces actually invest less than the Canadian average, at about 0.23%. And here's the thing, when we add the increased investment in kindergarten for 5-year-olds, it moves BC's public investment to about 0.29%. Still the lowest investment overall, and less than half of the OECD average from about 10 years ago, and less than a third of the UNICEF benchmark of 1% of GDP. And just to remind you of the difference that Quebec makes in Canada's calculation, let me go on to those slides. With only 22% of the population of young children under 12, Quebec has over 40% of Canada's childcare spaces and invests almost 2/3 of Canada's public funds, of Canada's total public investment in regulated childcare. So to summarize this section, yes, spending on early years programs and services has definitely gone up in BC and elsewhere in Canada over the last decade, but not at the scale required to reduce the squeeze on families with young children today, and therefore not at the scale required to reduce early vulnerability. The investments that have been made are really important, and the efforts of every single person who works directly with or on behalf of families with young children are critical. Collectively, one might say that you're holding your fingers in the dike of family stress and early vulnerability. But your fingers are not enough, because the time and the money and the service squeeze is too high, and the public policy holes in the dike are too big. That's why our work at Generation Squeezed is focused on a public awareness raising campaign that aims to significantly advance the public understanding of the depth of these issues and the solution. And now moving on to a question that perhaps you're wondering at this point, and that is, why the emphasis on childcare in the analysis of family policy and families with young children? I think this is a really interesting and important question, and there are many ways to respond to it. Today, I'm going to reflect on one thing, and that is to understand, I think that one thing that stands behind this question is a concern, a really fundamental underlying concern, which is a worry that if we increase access to childcare, that will reduce the time for parents to care personally for their children. And if that's a question and a worry, then I want to reassure you that the answer to that is no. That's not what happens in places with strong childcare systems, and that's not what we propose in the New Deal for Families. So let's talk a little more about parents' time with children. Specifically, I want to talk about parental leave. Again, back to our comparisons of Canada to 2 Nordic countries and 3 peer nations. When it comes to parental leave, we often think of Canada as being a pretty generous country, and indeed, in this slide, you can see that we're mid-ranked in terms of the parental leave benchmark. And the benchmark that UNICEF was using in its report, which is where this comes from, is looking at 1 year of leave at 50% of average salary. However, we don't in Canada have reserved time for dads, except in Quebec. So that's one of the reasons why we didn't get a point on the UNICEF scale for this benchmark. And there were no part marks assigned. So as a side note, that's one reality, you might say a weakness, with the approach used in the UNICEF report. While Canada clearly has a far superior approach to parental leave than either Australia or the US, the US has none and Australia is just introducing some now, none of them met the minimum standards, so all received a 0, Australia, US, and Canada. Note that the Nordic countries have far more generous parental leave programs than Canada does, and they meet the UNICEF benchmark because they also reserve time for dads. So let's look at Canada a little more closely here. The common usage of the description 1 year parental leave in Canada doesn't tell the whole story. Because one has to meet minimum levels of employment prior to the leave in order to be eligible. And the benefits that are paid on leave are often so low that many of those who are eligible can't afford to utilize a full 50 weeks of leave. In fact, in Canada, overall, only about 2/3 of moms utilize paid parental leave. But here's the thing that's shown on this slide. Uptake is higher and longer for moms in Quebec, which has more generous leave benefits. It's also higher for dads in Quebec, where there is legislated time reserved for fathers. As Quebec expanded its childcare system, it also expanded parental leave. Both are part of a comprehensive family policy and suggest that parents in Quebec have more time and incomes to care personally for their infants than families outside of Quebec. And this approach is consistent with what we see elsewhere, which is that countries that have strong childcare systems also have generous leave provisions. Infants and young toddlers in the Nordic countries, for example, are much more likely to be cared for exclusively by parents and immediate family members than they are in Canada. Let me just restate that. Countries that rank well on family policy provide more time and income for parental care early on. And this finding that I'm referring to of almost exclusive parental care early on does not hold in provinces like BC. The models that Paul Kershaw and I have developed estimate that 26% of children under 18 months and 49% of children aged 18 months to 3 years experience some form of child care in addition to parental care. So 22 and 4 shown on the first column of the slide, and then 39 and 10. But because, as you can see, there are very few regulated spaces for very young children, the majority of that care is unregulated, meaning it is not monitored and not required to meet significant certain standards. Now, as children age, as you can see on the slide, more regulated options are available, and because the staff ratios change, they're slightly more affordable. And by the time children are 5 years old, as we know, or 4 years in some provinces, Ontario particularly, about 90% experience at least one out-of-home experience, and that's kindergarten, which is free. And it is in fact this reality of the out-of-home experiences of children today that led UNICEF to observe and talk about the great change coming over childhood in the world's richest countries, observing that the majority of young children in developing countries experience some form of out-of-home care drove UNICEF to prepare the Family Policy Report Card that we've been looking at and talking about in some detail here. Because, as you know, the science of early child development tells us that these out-of-home experiences have the potential to be a great opportunity for young children if they're done well. But they also have the possibility of being a risk if not. And I've already told you that regulated child care in Canada today receives insufficient funding and policy attention to ensure that it is consistently at the level of quality that will advance healthy development. And research also indicates that quality in unregulated care arrangements is generally lower than in regulated care. And we've seen some of this. Let me just close down this little note here. Sorry, that's coming up on the screen. Ah, there we go. And we've seen this more recently. We've seen the headlines that tell us about these concerns. And it's a sensitive topic to raise because we also know that most early childhood educators and other caregivers are doing their best without the public policy tools that they need. And so are parents who have really limited choices, as we've already discussed. But I think it's time to figure out a way to talk about these concerns, because by being sensitive to adults, we're putting children at risk. And so far, the kind of gentle nudges around this issue raise another related question, which is, can we really do better? Can we really build a system of childcare that is good for young children and families in our society? Is it possible and reasonable to do better with non-parental care? And you know, the science is really clear on that, and the answer is yes, we can. And I'm going to just provide 2 studies to point to that conclusion. First of all, there's a Norwegian study that followed, it was a 30-year follow-up study of the large-scale growth of universal child care in Norway, and it confirmed a number of really important things. First of all, that positive effects were substantial over time. They were demonstrated through increased education and earnings outcomes, lower welfare rates, etc. And these outcomes were achieved in ways that reduced inequities or leveled the playing field. And if you that's one study. It was one very in-depth one. It was done over 30 years of tracking. Nonetheless, it was just one study. And occasionally we hear about one single studies that show that childcare doesn't have these results. And I want to remind us that the key thing to assess is the quality of the programs, because we only get good results with quality care, and we know that poor quality care can be harmful. And so let's close this section with, in fact, a meta-analysis, which is a review of a number of findings that were, these results were affirmed, the Norwegian results were affirmed by a meta-analysis co-authored by Steve Barnett in the US. He's a legendary economist who led the benefit cost analyses of the Perry Preschool Project. And he indicated in a 2010 statistical summary of 123 US studies that, in fact, these findings were all valid. Now, the Norwegian study, as I said, provided another important finding, that the growth in regulated care did not reduce parental care. Instead, children moved from unregulated to regulated care. This is consistent with our New Deal models overall. Our projections show that with a New Deal for families, there will be more care by parents and immediate family members when children are under 18 months, followed by a movement from unregulated to regulated care. So back to that original question in the section, why the emphasis on childcare? Because the majority of BC's young children are already experiencing some form of early care and learning in addition to parental care. And so the real question that we have to ask is, when will we accept this reality and put policies and resources in place to reduce their exposure to care that puts their healthy development at risk? In fact, when will we implement the New Deal for families? Knowing that when we do, we can move Canada from its bottom-ranked position on the UNICEF benchmarks to a top-ranked position, because we will be addressing the 10 benchmarks that UNICEF introduced based on the research actually address the time and money and the service squeeze that we have been describing and experiencing here in Canada. What we're talking about with the New Deal for Families is a level of public investment and planning that will expand parental leave, moving to the top, and that will grow access to quality, affordable, $10 a day child care. Between the expanded access to parental leave that pays higher benefits to families and the reduced cost of child care, we will effectively eliminate poverty for families with children under 6 in this country. And we will be able to, in fact, hit every single one of the 10 benchmarks established by UNICEF. And let me close with our final question, given this solution. Is the cooperation that we need to make the New Deal come true actually possible between the various levels of government? I believe it is, and I believe we have examples. I will show you examples of where we've made that come true. Some might point to something as recent, given that we have news coverage of Sochi right now. I'm reminded of the 2010 Olympics here in Vancouver, which in and of themselves required several years of federal, provincial, municipal, and cross-sectoral collaboration to bring their success about. But here's another example. When the recession first hit, Canada launched its Economic Action Plan, and the Auditor General reviewed the results of that action plan 2 years later, and she observed that in just 2 years, over $60 billion in federal, provincial, and territorial funding were put out to develop through 90 programs that required 35 federal entities to work with provinces, territories, municipalities, non-government organizations, and the private sector. And in commenting on that work, here's what the former Auditor General Fraser had to say. She said that when tasked with rolling out a complex and time-sensitive initiative, departments work together to achieve timely implementation while paying considerable attention to risk. When senior officials give priority to large initiatives, in other words, when the political will is there, public servants rise to the challenge. And so the real question is, can we make this a priority? And I say we can make the New Deal a priority when we're prepared to make Canada's Family Action Plan as important a priority as Canada's Economic Action Plan. And that is something that, as I say, our Generation Squeeze campaign is working hard to do. Thank you for your attention through this, presentation, and I really welcome your questions now.
Okay, great. So I will be the moderator for this part of the session. If anybody has any questions, you can and I'll let Lynell know what those are. Once again, if you have questions that you would rather pose to Lynell personally, you can send her an email, lynell.anderson@upc.ca, and all of that info is on the Human Early Learning Partnership website. No questions? Here we go. Okay, great. What is the data source for the care arrangement slide?
So the there's a range of data sources there, and I probably should follow up with somebody individually or put the note out. We used some Statistics Canada data. We used some reports that have been done by researchers led by Gordon Cleveland that used the parental survey data, and we also use data from the Child Care Resource and Research Unit on spaces available, the Early Childhood Education and Care in Canada reports.
Okay, next question is, what is OECD?
Thank you. Yes, the Organization for Economic Cooperation and Development is an affiliation of developed countries around the world. I believe there's around 30 of them, or slightly over 30. Canada is a member, as are most other developed countries, and they, as the title would suggest, they've come together. They've come together to share information that will help advance and support everybody to be stronger economically, socially. Those are the two main goals. So they share a number of indicators, and they collaborate around research, not just around family policy, around economics and labor and employment, all kinds of issues.
Okay, great. Any other questions? I know Lynell did talk about the New Deal for Families. That policy document is available on the Gen Squeeze website. And if you can't manage to find it, just send Lynell an email, or you can email myself to jennifer.fox@ubc.ca. Okay, Nicola, you have a question that you'd like to answer with your microphone. Go ahead. Sorry, go ahead again. Just make sure you have your microphone turned on. Okay, so the question was already answered. That's great. Nazreen, you have a question for Lynell?
Yes, yes. Could you please a little explain about policy family for me?
Can you repeat that last part?
Could you please a little explain about the policy family?
The family policy, right?
Yeah,
so, right. So by family policy, we look at, in general, the ways that we support families with young children, the actions that we take as a society, so through government, to support families with young children. And there are various things that we do. For example, the fact that we have access to health care. Health care would be part of an important policy that supports families with young children, as well as everybody. Education, to the extent that it reaches young children, is a policy, an important policy. We have governments put in policies to support families who may be lower or modest incomes, and so there'll be cash transfers to support families. So it is the actions and programs and services that governments put in place to provide services and supports for families.
Great. Okay, next question is, what large-scale efforts are occurring to make public and government bodies aware that action or funding is needed for this kind of thing?
Well, you know, that's a really important question. Over the last, I mean, for many years, some people would say for many years, we have talked about and worked on and done research that highlights the importance of the early years and the importance of having high quality environments in the home and in the community for young children. And HELP itself has been involved in facilitating, creating, and sharing that research for more than a decade. And that, in the initial years, that was and still remains a primary focus of the work, and it is the foundation of the work, and we continue to carry out and share that research. And so that has been a primary piece of the work. But it is also true that that part of affecting the policy change and the part of making governments aware of the need to act is to raise the public awareness of that. And the focus of our Generation Squeeze campaign now is to say, look, we know that we need policy change, which means that we need political will. But in order to build that political will, we need to raise public awareness. There needs to be public awareness and public pressure to address the needs of young generations, just like we have public pressure to address the needs of older generations to maintain pensions and health care, and we have public pressure to ensure that we have an economy that supports business and so on. So, so our work now is focused, in addition to the research, on raising the public awareness and changing that stat that I showed you at the very beginning of this presentation. We want to reach a point where the majority of Canadians know and believe that Canada is weak in supporting families with young children and are prepared to apply pressure to make that change.
Okay, great. Any last questions for Lynell? In case anybody was wondering, this will be available as a video after the event, so I will email that out to everybody. So in case you missed anything in particular, you have another chance to see that on the video. Another question, is the problem with funding too closely tied to financial and business institutions and demographic voting patterns, and for this reason doesn't get enough political will?
That's another wonderful question. In terms of demographic voting patterns, I mean, there's no question that older generations tend to vote, and that understandably political parties and politicians respond to those who vote. That is a primary response. So there is no question that our work is focused on raising public awareness and raising public engagement, particularly among younger generations, but also among generations of my age who are concerned about families with young children and younger generations. And so absolutely, as part of our raising public awareness and raising engagement, we want to also encourage participation in voting.
Excellent. Well, it looks like there aren't any more questions, so I'll give the last word to you, Lynell.
Thank you so much, Jennifer. And so I did just want to close and again by saying thank you for your time, thank you for your interest, and close with a quote from Thomas King as I began. And I'm paraphrasing and clearly adding in some of my own references here, but he does wonderfully say that what happens from this information is up to each one of us. So feel free to take this story because it's yours and do with it what you will, he would say. And I've suggested some things we could do with it. We could write a letter. We could join the Generation Squeeze campaign. And he would say we could forget it. But don't say in the years to come that you would have lived your life differently if only you had heard the story, because you've heard it now. Thank you so much for listening. Bye for now.